Okay, so next is antipsychotics. Psychosis develops due to increased dopamine activity in the central nervous system, and these psychotic personalities have both positive symptoms as well as negative symptoms. Positive symptoms means those that are added to his personality, like delusion and hallucination, and negative symptoms are those that are taken away from the normal personality, like there is social withdrawal, loss of emotion, etc. Typical antipsychotics like chlorpromazine and haloperidol block the dopamine receptors and can manage the positive symptoms, right? But cannot manage negative symptoms. Atypical antipsychotic has little blockage on dopamine receptors and has more antagonist activity on 5-hydroxytryptamine, so therefore they can manage both positive as well as negative symptoms. Since dopamine is a main neurotransmitter in basal ganglia, remember we talked about dopamine in basal ganglia circuit, which was helpful in initiating movement. Since you are blocking dopamine, now you'll have problem in initiating movement that are called extrapyramidal side effects. Like patient will have dystonia, he'll have fixed his neck like torticollis, he'll have difficulty in initiating movement, tardive dyskinesia and akathisia, etc. These are extrapyramidal side effects. But the good news about atypical antipsychotic is we don't see extrapyramidal side effect because there is little dopamine antagonist activity. So atypical antipsychotics are clozapine, olanzapine, zotapine, amisulpride. Amisulpride is sort of a different drug. It is structurally actually typical antipsychotic, like say it has dopamine antagonist activity and less amount of 5-hydroxytryptamine activity, but still it is classified into atypical antipsychotic because it is producing less extrapyramidal side effect. So all are side effect of clozapine, except clozapine is a atypical antipsychotic, so extrapyramidal side effect are less, and amisulpride shows less 5-hydroxytryptamine antagonism. Okay, so let's begin with antidepressants and anti-manic drugs. This question says that which of the following drug can be withdrawn abruptly and need not to be tapered. The research says that Prozac, which is a brand name for fluoxetine, produce least amount of withdrawal symptoms if it is abruptly stopped, but it is always advisable to taper the antidepressants or antipsychotics or anti-epileptics or steroids or opioids, right? Otherwise they would precipitate withdrawal symptoms. Lithium is mainly used in bipolar disorder, and the main side effect of lithium are it will increase the leukocyte count, and it also potentiates the action of muscle relaxant. So if you are planning for surgery, please stop lithium a day before, right? It will produce tremor, and this can also produce hypothyroidism, right? You remember amiodarone, which can cause hypo or hypothyroidism, and the second one is lithium. It will increase the urine, it damages the distal portion of the nephron, so you must do a regular renal function test, or by creatinine level you can judge the renal function test. And it is a teratogenic and it will cause cardiac malformation. So it causes cardiac malformation. You should always do renal function test and you should stop a day before surgery.